Hello everyone, Maria Trusa from Formé Medical Center and Urgent Care, and I am here with Dr. Gary Middleton, our medical director. How are you, doctor?
Good, fine.
Working hard. We are working long days to make sure that we are up to date with all the information that is coming out about the coronavirus so that we can protect our staff, our patients, and the community. So, doctor, we are going to make sure that the information we're giving is accurate, because we were talking about how there's so many misinformation being given out there that I was telling you that there was something that you cargo water or you keep your, is that true?
It's not true. I've already seen a few chain emails going around about holding your breath with cold water, and if you don't cough, it means you're fine, about keeping your mouth moist. There's nothing to that. It's been debunked. It's just not true.
So make sure that the information that you're getting, it is accurate. I can tell you that we are experiencing daily changes in this office. Daily, and it's not just our office. All the offices, all the medical practices are experiencing decisions that need to be made, including laying off people, which is really hard. And this is happening everywhere. But now what we've decided to do as of today, what are the changes that we're making here?
Well, we're not accepting any walk-ins. So we want everyone to call ahead of time so we can pre-screen them before coming in. And that's actually a recommendation from the Department of Health.
Yeah, so please do not come to the office if you have the flu-like symptoms. I know that, we had some patients that they call and they say, well, I'm just coughing, I don't have a fever. If any of the answers to the questions that we're going to ask on the phone that were written by the Department of Health, if the answer is yes, that means you have to stay home. You should be in quarantine for 14 days. You should not go out. You should not come to the office. Doctor, so a lot of people are afraid because then they're saying, like, what do I do? Like, I just stay home. We're used to being taken care of. We're used to having the doctor sort of examine us, order things that need to be ordered. So what's your advice to the people when they're staying home?
Well, first of all, you really should, as you say, you should quarantine yourself for 14 days, especially if you have a fever. We do not test for the coronavirus. That's number one. We can do telemedicine, so we can help, and we can try and examine as best we can by telemedicine. And if anyone needs anything, we can send prescriptions to the pharmacy like that. But quarantine, there's plenty of things you can take over the counter that can at least help with your symptoms. Remember, God forbid you have this virus, there's no cure for it. You just have to fight it. So you got to help your body fight it. Plenty of liquids. Keep yourself hydrated. Tylenol, Motrin, Advil. Those are really good things to help the aches, pains, and certainly with the fever.
Like if your throat is hurting you, what's the best thing?
The best thing is Cepacol. It has something called benzocaine in it, and it's an anesthetic. And as you swallow it,
what's the name again?
Cepacol.
Cepacol.
Or if you look for it generically, and if you look at the ingredients on the back, what you're looking for is benzocaine.
Okay, so telemedicine is actually something that everyone is pushing. The insurance companies have decided that they're going to be paying for telemedicine. I read up to some of them until June, but obviously if this gets extended, they will continue to cover it. So most of you that have insurance will be able to get covered by telemedicine. So you can call Formé, you can make an appointment, 914-723-4900. Dr. Middleton is actually doing telemedicine from 8 o'clock until 8 at night. So we are going to be very available to you from right now. It's from Monday through Friday. Things might change. We might add more doctors to help out depending on the need of the community. So we're pushing you to please get registered to do telemedicine. if you are, because a lot of people get afraid, and if you're afraid and you want some answers, just schedule a telemedicine visit. We have the telemedicine link on our website, so you can go at formemedicalcenter.com, and on the right top it says telemedicine, so you could actually schedule your appointment, request your appointment with Dr. Middleton or other providers that will be helping us in the near future. So we again, we want to make sure that you understand that if you feel that you need the test, so let's talk about there's facilities, right, that in the area that are doing the tests.
Yeah, they set up a hotline. The Department of Health just set up a hotline. They answered. I called it last week, and you can ask anything. It's for everyone. It's not just for people in the healthcare field. Anyone can call. You can ask any questions, and they can tell you where you can go and get tested.
So I'm going to give you that number, and this is for the patients. Any one of you can call, and you can ask questions and see if you will qualify for testing. They're opening sites in, I know that, I don't think it's official, but I know that Westchester Medical Center is working on setting up a site. I'm not sure if they're open, but you can find out. White Plains Hospital is not, as of today, they're not testing for the coronavirus, and neither are we. So we want to make sure you understand we are not testing. We don't have the proper equipment to test. You have to be properly equipped to make sure that you don't get the virus and you don't continue to spread it. So the hotline to call is 888-364-3065, 888-364-3065. You can call there and make your appointment. What is the best advice to people now that are going to the supermarket? You know, they have to still go to the supermarket, or they might have to go to CVS, pick up their medicine. What's the best advice that you can give them?
As soon as you can, wash your hands at least 20 seconds. You can use those alcohol-based hand sanitizers. Those are fine too. If you can't wash your hands for 20 seconds, because this can live on surfaces. You don't have to come to a clinic to get it. You know, you can go to the bank, someone coughs on their hands, they touch the pen at the bank, you pick up the pen, well, guess what? Then you scratch your face, you got it. So that's how the common cold is spread too. So this spreads, and the flu. So this spreads the same way. So again, it's what we call social distancing and hand hygiene. Try not to touch your face.
I just saw a video that talked about your phone. So I know that we're wearing gloves here, whatever, like right now we just took them off to do this show, but we are wearing gloves every day at the office. And do you suggest that people wear gloves if they're going out?
I mean, I don't know if I can officially suggest it.
But it makes sense.
But it does make sense.
Yeah, so especially if you are at risk and you have to go out, I would say, why not wear gloves? So if you can get your hands on gloves. The mask, they're saying to save it for the medical the personnel. I think this is something that if you're not sick, they're saying don't wear the mask, you leave it, because we are going to need it in the medical field, so that's important.
And it won't protect you anyway.
Right.
If you don't have the right kind and you're not fitted for it, these surgical masks are not helping anybody. They're not.
Okay, so the phone, let's make sure you wipe the phone. I'm gonna use hand sanitizer. I just thought about this today because I take off my gloves and then I'm touching my phone, which is something that you're on the phone all the time. So that's something that I want you to pay attention to. The other thing is, again, telemedicine is the way. This is the new way of seeing your doctor.
And this is being pushed by all the insurance companies,
the
by
Department of Health, everyone. So we want to announce that for our members, so if you're a member of Formé, you actually don't have to pay. So our members don't have insurance, so you can get in touch with the doctor and do telecalls, and you will not have to pay. We want to make sure you know that. So doctor, thank you so much. We'll be back We're going to be coming to you on a daily basis with different information because we want to make sure that you are informed correctly, and your health is our mission. Thank you so much for following us, and please ask any questions that you need answers to, okay? Take care. Bye-bye. Be safe.